So one of the things I think is a simple but useful tip in terms of visualizing what the patient is going to see is once I've drawn in a hairline and designed all the features that will make it look natural for the long term, I always like to stand behind a patient to see what the patient is going to see. It's a simple tip, but looking straight on at a patient is different than looking over a patient's shoulder and envisioning what the patient is going to see. So raise your eyebrows. Good, and now scowl a little bit. Yeah, so this proportion, somewhat elevated, Jeff tends to wear his hair kind of combed upward. It looks good. I think the proportion is right. And there's not perfect, turn a little bit this way, there's not perfect symmetry, but the balance is there. Turn the other side. And so this is a successful, well-designed hairline that I can best visualize seeing what the patient sees in a two-dimensional surface. So when we think about hairline design, there are a number of aesthetic parameters that I take into account. There are no laws, there are guidelines. I'm going to hold this next to you for a second. So this is a gentleman who had a transplant with me, and this is a designed hairline, right? One proportion we think about is the rule of thirds, meaning about a third from the chin to the nose, a third to the top of the eyebrow, a third to the beginning of the hairline. So that one-third proportion draws attention to the eyes. That's the goal. The other thing I'll ask you to do is take your fingers, take your hand. This is called the four-finger rule. You may have heard of this one. Lift your elbow up a tiny bit and lift your hand up a little bit. So if the edge of the pinky, if you take that as the top of the eyebrow, move your hand away now. So where the four fingers of an individual's hand march out, that's about where the hairline starts. You can see also that we're a little below that four-finger rule for Jeff. And it was very important that you design a hairline that leaves subtle irregularities. Nature doesn't provide a straight hairline. Nature doesn't give most ethnic groups, most patients don't have a flat hairline. So receded and irregular so that this looks natural. And the goal is if Jeff were ever to do a second transplant, it might be to add density, but the shape looks natural and will stand the test of time throughout your 20s, 30s, and beyond. One other thing I like to do is to envision the horizon, the intersection of two planes. So we think about the average plane of the forehead, not straight up and down vertical, but a little bit of an arc to the forehead, and the average plane across the top of the head. And if we bisect those two planes, we're right about here. So we sort of have got a point where we're not beyond the edge of that visual horizon. So there are a number of factors to come into play, and ultimately the takeaway here is make certain you collaborate with the patient, take a look in a mirror over the patient's shoulder so that you design something that looks proper.